So let's go to the second part and talk about tissue management before impression. Either if you are using analogic technique like a VPS impression, or if you are using intraoral scanner, a digital approach. As a disclaimer, I am a medical consultant for EMA territory for Centrix Dental. The products that I'm going to show you, those are from Centrix, but it's more important the technique and what you can achieve in terms of gingival retraction by using chemical means. We are used to retraction cord. I still use retraction cord, and in some cases it's irreplaceable, especially when you have a deep subgingival margin. The retraction cord is considered to be the golden standard, especially when you are using double cord technique. And why double cord? In the first place, you have the first retraction cord that will push the gingiva in a more apical way. So by pushing the gingiva away, you can have more visual access to the limit of the preparation, especially when you are preparing subgingivally. And then you are placing the second retraction cord. This one it's a little bit more wider, it's more thicker, so this one will push on the horizontal direction the gingiva. After that, you are removing the second retraction cord, and then you are moving fast and taking the wash impression material and take the impression. Keep in mind that you have around 30 seconds since you are removing the second retraction cord to place the impression material. Otherwise, the gingiva will collapse and you have to redo it again. So this is the regular technique, it's speed. So you are taking the retraction cord, usually soak it in the astringent solution to stop the bleeding and also further promote the gingival retraction. So what I'm going to show to you right now, those are two products designed for gingival retraction and especially for stopping the bleeding. Those are called Edge and AccessFLO. They are kaolin based retraction material. They are containing also an astringent, aluminum chloride, and basically they are one and the same product. What is different between them is the viscosity. So it's a matter of preferences. Some dentists will like more AccessFLO because it's more fluid. It will be much easier to wash it away. I myself, I prefer more Edge because it will have a thicker consistency, and even when you're applying this material at the gingival level, it will mechanically push the gingiva. And you have also the gingi cap. Those are compression cap that you can use them together with the retraction material and further promote the gingival retraction. So if you have a mixture by chemical and mechanical retraction, and how they are working. So in the first place, when you're applying the material, the aluminum chloride will generate vasoconstriction. You have vasoconstriction, you have less blood flow, so the gingiva will shrink the volume, and then the kaolin clay will take over, and it will start to absorb the water from the gingiva and further on perform a gingival retraction and lower the volume of the gingiva. It works great for also stopping the bleeding. You can use them by themselves and replacing the retraction cord, or you can use them in a double cord technique. And in this case, you are placing a retraction cord, a 00, 000, and instead placing the second retraction cord, you are placing this kaolin clay, and you'll have also gentle retraction, stopping the bleeding, and it will cause less gingival trauma. So let's see how AccessEdge will perform. So you are injecting, you are placing the material in the gingival sulcus. Take a look at the gingiva is getting whiter at the same time when you are applying the material because of the vasoconstriction. After 2-3 minutes, you are washing thoroughly. Keep in mind you should wash really well. Wash with a lot of pressure. Don't be afraid. You'll have no secondary bleeding. After that, you are just drying the field and you are performing the impression. Here, it's a double core technique because we have subgingival margin. So in the first place, I place a double zero retraction cord, but instead of placing the second retraction cord, I use AccessEdge as a secondary retraction cord. Here, it's another case. Here, I will not use a retraction cord. I will use only AccessEdge. So after preparing the tooth, place AccessEdge. And because we want more retraction, I will place the gingicap, ask the patient to bite, and you'll have also mechanical retraction in an apical direction by the pressure of the biting force of the patient. And that's the situation, that's the impression, and you can clearly see here the margin without using any retraction cord. And this is AccessFLO. As I told you, they have the same chemistry, AccessEdge and AccessFLO. This one, it's a little bit more fluid. It will have a thinner tip. Here is just a demonstration to make an idea about the consistency of the material. As with AccessEdge, apply the material, leave it in place for 2-3 minutes. If you have a preparation, you also can use gingicap, the compression cap. After 2-3 minutes, wash it really well, and then you can perform the impression. Of course, you can use this material if you have, for example, interdental proximal decay or a gingival close to the gingival decay, so you'll have inflamed gingiva and you'll have a lot of bleeding. Use this material to stop the bleeding. So, in theory, everything sounds good. Let's see right now how it will act in reality. We all know that retraction cord, the classical approach, it will generate around 0.5 millimeter of retraction. So let's see how AccessEdge and AccessFLO will perform in comparison with the retraction cord. This is the initial situation. Old composite filling. We have some chips from the lateral incisor. So the patient came in with the main complaint, with the chief complaint about aesthetics. So here we have the provisionals in place because the patient was gone for 2-3 months. You can see here bacterial infiltration. So the provisional cement start to get infiltrated by bacteria. And keep in mind, before cement a final crown, you should always clean really well the tooth surface. If you have biofilm in there, you'll have no adhesion. You are risking secondary decay or you are risking decementation. So we are removing the provisionals. We are taking a digital impression. Clean the teeth really well. This is with sandblasting, but we are generating a lot of bleeding. And that's why I'm using AccessEdge to stop the bleeding and also to perform some gingival retraction. I will start to wash after 2-3 minutes. AccessEdge really well. And you can see the gingival retraction because there are some bits of cement that, well, they weren't visible. I will take the second scan and I'll overimpose those two the clinical situation. And as you can see, after using AccessEdge, we have a gingival retraction of 0 0.54. So the gingival retraction generated by AccessEdge alone, without any retraction cord, was on par with the golden standard technique with two retraction cord with the double cord technique. So by himself, AccessEdge, it's really effective in generating gingival retraction, as you can saw it, also stopping really efficient the bleeding. So let's go. This is the final case after cementing the veneers and right after removing the excess cement. So let's start the presentation. Let's go further in the presentation with more clinical cases. And here, this is a preparation with the shoulder. It's a little bit subgingivally, but of course, after preparation, we are going to have some bleeding. I will apply AccessEdge, leave it for 2-3 minutes, and take a look here. The bleeding has stopped. I will take the impression, and this is after casting the model. You can clearly see, and every dental technician can see the margins, and that retraction was generated only by AccessEdge without using any retraction cord. So you have also gingival retraction, and also you have stopping the bleeding with AccessEdge. Another case with the e.max crown. This is the initial case. So in the central incisor, those are two PFM old crowns. You can see on the lateral incisor old composite fillings. After removing the crowns and the fillings, because the margin it's deep subgingivally, we are going to use a retraction cord. But instead of using the double cord technique, we are going to use AccessEdge over the first retraction cord. Apply AccessEdge. Leave it for 2-3 minutes in place. Wash it really well. Leave the first retraction cord in place as usual. Don't take it out. Those are the provisional. And those are the final crowns right after cementation. That's why you can see here the black triangle. But that close in, I think, 6-month time. This is an old case. It's a case done, I think, 6-7 years ago. Another case, let's see how effective AccessEdge and AccessFLO will be for stopping the bleeding. This is a case for cementation. In this case, I didn't place a temporary crown in here. So when the patient came back for the final crown, you can see a lot of bacterial infiltration. You'll have a lot of biofilm. And as I told you, right now, if you are cementing the final crown over this tooth, for sure you are going to have in time secondary, you are going to have a decay under the crown, or you are going to have a loose crown. So in the first place, you should clean really well the preparation. I will use intraoral sandblasting. This is AquaCare. But as always, when you are cleaning really well a tooth, you are going to have a lot of bleeding. There is no other way. You cannot clean it without generating the bleeding. Once you have bleeding, you cannot cement. So in this case, we should perform hemostasis in the first place, stopping the bleeding. So I will place AccessEdge. I will place a gingi-cap. Ask the patient to bite. And because I don't use any retraction cord, I will not produce any gingival trauma. Wash it really, really well. And right now the tooth is clean. We have stopped the bleeding. And now you can go further with the cementation procedure. And I will use absolute here. It's also cement from Centrix, which is self-etch dual cure cement. Another case with e.max veneers. This is an initial situation, also old composite fillings with the image after preparation. I will use only AccessEdge in this case for gingival retraction without using any retraction cord. As you can see here, we're having a visual result. You can clearly see by the naked eye the gingival retraction. Those are the provisional in place. They are held in place by a spot etch technique. And those are the final veneers done from e.max. Another case with an e.max crown. So we'll take care of this premolar, which had a root canal treatment. So this is the preparation procedure. Also, the margin is subgingivally in this case. And I'll use AccessEdge. Take a look at the gingiva, how it's getting whiter when we are applying this material because of the vasoconstriction. Place gingicap, ask the patient to bite for 2-3 minutes. Wash it really, really well. And now you'll have a dry field, you have gingival retraction, you can perform the impression. So you can clearly see here the margin of the preparation that it's easy to tell. Here it's another view. And this is the cementation procedure. Another case with PMMA, provisional crowns. So this is the initial situation. A patient that like a lot to drink a lot of juices, so especially Coke, and you can see what they have done to his teeth. He has a complete erosion. In the first session, I treat the central incisor, the 21, number 21. He had a fracture with an open pulp chamber, so I'll perform a root canal treatment. I place a glass fiber post and build it with a core buildup. This is the impression session. So you see here a retraction cord in place. So we are going to use a double cord technique, but in this case, we are not going to use also a retraction cord as a secondary retraction. We are going to use AccessEdge. So place a 00 cord, place AccessEdge. This is the conformation of the gingicap. Place the gingicaps around the preparation, ask the patient to bite. After 2-3 minutes, remove the gingicap, wash it really, really well. I told you, don't be afraid to wash with a lot of pressure. You are not going to see secondary bleeding. So you have hemostasis, you have a dry field, you have gingival retraction. Keep the first retraction cord in place, apply wash material. And this is the cast stone. And again, during the cementation procedure, I will use again AccessEdge to take care of fluids on the gingival level. also to have gingival retraction, and I will have exposed margin, and also I will control the bleeding. So as you can see, this material will have double utilization during impression and also during the cementation procedure. After 2-3 minutes, you just wash it really well. This is the cementation procedure. And those are e.max crowns. I forgot to take a picture after cleaning the cement. Another case with PMMA provisionals and with a Zirconia final crown. This is the situation after I I prepared the teeth and made the provisional bridge on the central and the lateral incisor. So this patient had also 2 implants. It was a difficult case. As you can see, there is a retraction cord in place. I will use double cord technique with a retraction cord, and after that I will place access edge. This is after I wash away access edge after 2-3 minutes. You can see the impression and transfer abutments over the implants. This is the provisional bridge, the provisional work done from PMMA. It was kept in place for 6 months. This is the cast model stones. The final work was milled. This is a ExoCAD design, and this is the final work done from Zirconia. So also Zirconia over implants, the frontal area and the lateral, the second quadrant here, everything was done from Zirconia. Another view. And another case with more Zirconia crowns. I think this one is the last one. So also a complex situation. We'll have 3 bridges, one in the first quadrant on the incisor group, also over the implants in the second quadrant, and also in individual crown on the number 27 tooth here. So this is the impression session. A double zero cord in place. I will place access edge to further promote the gingival retraction. And also I want to take care of the inflamed gingiva here. I don't want any bleeding during the impression. So I will apply access edge. One dose of access edge is enough for around 4-5 preparations. So it's enough material in there. With 2 doses, you can perform gingival retraction all the teeth in this case. Don't go too much subgingivally. Just place the nozzle right over the retraction cord. Don't try to get too deeper into the sulcus. So you are doing slowly. Just be sure you are placing material all over the sulcus. If you need to make any adjustment to the material, don't take a metal spatula because the material will stick to the metal. Use a cotton roll. After 2-3 minutes, wash it really well. And now you have a dry field, you have stopped the bleeding, you have a gingival retraction, apply the impression material. This is with the custom tray because we have also some implants there. This is the open tray. And this is the final impression. And now this is the cementation session, after removing the provisional crown and bridges, again using intraoral sandblasting with aqua care to remove every bit of provisional cement and to be sure that we are removing any biofilm. But as always, when you want a clean teeth, you are going to have some bleeding in there. There is no other way. Once you have bleeding, you cannot cement. So in this case, the first thing that you want to do is to take care of the bleeding. So what we can do in this case, of course, we are going to use AccessEdge for stopping the bleeding, to have gingival retraction, and also to have a dry field. Be sure you are placing also on the oral side. As you can see in the mirror, there is also some bleeding in there. Make any adjustment with a cotton roll, don't use a spatula. This is after washing really well at AccessEdge, drying the field, and now you can go further with the cementation procedure. Now you have clean surfaces, you have gingival retraction, you have a dry field, you have no gingival liquid seepage there. So you have the best world for adhesion here. I will use resin cement for the teeth. I will use a long temporary cement to cement it over the implants. Tap Licurate just to put the cement in a wax-like state, so it will be easier to clean it, all the surplus from there. And on the bottom is the initial situation. On the top is the final work. So, any questions? Okay, thank you.